My name is Dr. Ron Hecker, and you are watching the Weight Loss Surgery Channel.
Welcome to Weight Loss Surgery News. I'm your host, Leslie Thompson, and thank you for joining us today. In this week's news, we'll tell you what scientists have discovered about boosting the body's ability to burn fat. We'll also see how a lack of sleep may be causing serious physical consequences, including obesity. Plus, find out what one study reveals about whether people are really happier and healthier after weight loss surgery. But first, got private health insurance? Then you're likely to benefit more from weight loss surgery than people who don't. That's the finding of a new study out of Stanford University School of Medicine in California. The study's leader, Dr. John Morton of the Lucile Packard Children's Hospital at Stanford, collected data on 750 gastric bypass patients. He found that patients who relied on the government's Medicare program to pay for their weight loss surgery lost less weight afterwards than patients with private health insurance. In fact, while the Medicare group lost an impressive 57% of their excess weight, the private insurance group lost about 82%, Morton says. Dr. Morton believes Medicare patients lose less after bariatric surgery because they start out in worse shape. Medicare and Medicaid patients tend to be poor, disabled, and elderly, and often start the weight loss surgery process with an average body mass index of 50 or more. They also frequently suffer from depression, high blood pressure, heart disease, diabetes, unhealthy levels of cholesterol, and sleep apnea. Interestingly, although the private insurance patients lost more weight, the Medicare group had the greatest improvement in levels of low-density lipoprotein, or LDL, the so-called bad cholesterol that causes heart disease. They also had bigger improvements in fasting insulin, a measure of diabetes severity. In our next story, scientists now believe that being obese can make asthma medications less effective. Asthma is a disease that causes the linings of a person's bronchial tubes and lungs to become swollen, partially blocking their airway and reducing their ability to breathe. Corticosteroid drugs, which include brand names like Flovent, Asmacort, Symbicort, and Advair, can treat asthma by reducing inflammation and opening up the bronchial tubes. But a new study published in the Journal of Allergy and Clinical Immunology concludes that inhaled asthma medications are only about half as effective when taken by obese patients. The researchers looked at body mass index and treatment data on 1,256 people with mild to moderate asthma. Analysis of a subgroup of 183 asthma patients showed that lean people with asthma who used inhaled corticosteroids had a 55% lower level of a certain type of airway inflammation than did obese people who used the same drug. Too little is known about the relationship between obesity and inflammatory disease, but by studying the effect of anti-inflammatory drugs on asthma patients of all sizes, researchers may uncover important clues to provide more effective treatment. We're going to take a quick break. When we come back, we'll pay a visit with Yvonne McCarthy to get her latest recommendation for weight loss surgery support on the web. Then check out how scientists have turned some mice and perhaps someday humans into fat-burning machines. We'll be right back with more weight loss surgery news after the break.
Find out what's really going on in the bariatric community when the Weight Loss Surgery Channel brings you exclusive insider coverage of the 2009 annual meeting of the American Society for Metabolic and Bariatric Surgery from the Gaylord Texan Resort Hotel and Convention Center in Grapevine, Texas. We'll bring you the latest medical technologies, new surgical techniques, and groundbreaking research related to the treatment of obesity straight from the nation's leading doctors and healthcare professionals. The Weight Loss Surgery Channel is your all-access pass to the action. Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the Lap-Band AP system.